The row over cough syrups is growing in India. At least 24 children have lost their lives so far. This as the death toll in Madhya Pradesh has risen to at least 20. Earlier, the state government had confirmed the deaths of 16 children who had allegedly consumed cough syrup Colrif, samples of which were found to have toxic contents. 4 deaths have also been reported from the state of Rajasthan. The Madhya Pradesh Deputy Chief Minister confirmed the current death toll, saying that the children who died from the state were undergoing treatment for kidney failure after allegedly drinking the contaminated cough syrup. He also added that 5 children are currently being treated in Nagpur, 2 each in Government Medical College and Hospital, All India Institute of Medical Sciences, and 1 in a private hospital. And after the Madhya Pradesh government had banned 2 other cough syrups besides Colrif, the Telangana government has now issued a stop use notice for both these cough syrups. In fact, both of them were found to be adulterated with highly toxic diethylene glycol, an industrial solvent which when ingested can cause severe health complications and fatalities. Earlier, a report by Madhya Pradesh Drug Regulatory Authority revealed both the banned cough syrups marginally exceed the permissible limits of the substance, diethylene glycol and ethylene glycol, in the drug sample tests. And both these solvents, when consumed, can severely affect kidney, liver and nervous system. And following the deaths in Madhya Pradesh and Rajasthan across India, states have ramped up efforts to monitor the usage of cough syrups. A total of 9 states have banned cough syrups for children below 2 years. Considering the seriousness of the situation, the Tamil Nadu government has sealed the factory of a drug manufacturer located in the neighboring Kanchipuram district. In fact, a special investigation team formed by the Madhya Pradesh police is also expected to inspect the factory premises. Let's go straight across now to our esteemed guest on the broadcast, Padam Shri Dr. Sanjeev Bagai, Chairman, Nephron Clinic, leading pediatrician and nephrologist, joining us from New Delhi. Thanks very much for being here. You know, at this time, there's a lot of concern across the country, given the sensitivity of the matter and given what's happening. What would your initial comments be to also send out a message to the parents, and what can they do at this point?
Good evening. My first and foremost, my condolences and prayers for the families who've lost the small children and infants. Straight away, this is completely unacceptable. This was unexpected. And there is practically blatant misuse of every rules and regulations. There is no compliances. Perhaps there has been no security checks. There have been no forensic audits. There has been no quality control. The government also needs to step up the manpower and the resources to supervise and check the various outlets of manufacturing, not only of cough syrups, but any medication which is manufactured and produced in India. Now, this is the contaminant. Diethylene glycol and ethylene glycol are contaminants. They are industrial solvents which enter into a component known as glycerol or glycerine. What we have seen in the news so far in the last 24 hours, there has been more than 360 violations. There has been no quality control, no septic precautions taken, no pest control. So obviously, these kind of outlets are going to be fraught with danger. Once this compound enters the body, it is absorbed within 20 to 30 minutes. So practically, there is no catching it after that. It enters into the liver, it is metabolized, it enters the bloodstream. In the first phase, what we call as within 30 minutes to 12 hours, you have absolute intoxication, hallucinations, neurological damage. Within 12 hours to 24, 36 hours, you go into what we call as metabolic acidosis. Your system's body organs start shutting down. And within 24 to 72 hours, then your kidneys pack up, because this compound is metabolized into something which we call as oxalic acid. It forms crystals, it blocks your tubules in your kidneys and your main filtering membrane of your kidney, and your child goes into complete kidney shutdown. These very often in sick children, malnourished children, or with other comorbidities carries a very, very high fatality rate. the dose of this, the lethal dose and the toxic dose is so narrow that it is practically impossible to gauge when which child is going to react into a toxic level. I would urge the government to have absolutely uncompromising standards as far as medication which is produced in India. India is the pharmaceutical capital. It is the vaccine capital. It's giving a wrong messaging. It's completely wrong to subject small children to medication which is poisonous and adulterated. Medicines are used, but in calculated doses. It is calculated in milligram per kilogram per day. But to have this kind of poison entering into the medicine, you can't blame any medical professional here.
Right, and given that unfortunately deaths had to happen for this issue to be brought to light in such a manner, and for what we are now seeing, a public health crisis to unfold, you're saying that there were failures at multiple points. What do you think needs to happen from here onwards, and what about the parents who do want to perhaps administer cough syrups to their children from here onwards?
So two parts to your question. The first part is there needs to be absolutely strict guidelines towards a minimum standard of safety and quality control. With regards to cough syrups per se, combination cough syrups which contain variety of medications are always dangerous. You cannot have an antitussive, anti-allergic and a antipyretic fever medicine combined all rolled into one as a magic syrup. So medicines are to be used, but they are calculated according to the body weight and the indication what you're using it for. Cough syrups per se in very small children are best avoided because most of them are respiratory depressants. That means it decreases the breathing of small infants. But in a slightly older age group, it is to be used, but make sure what you're using it for. Do you want the cough to dry? Do you want the mucolytic, that means the mucus to come out? Do you want only an anti-allergic? Or indeed you want it for a bronchospasm or what we call as wheezing or asthma. So the indications have to be very, very accurate. Doses have to be calculated. Best public messaging is important. Use cough syrups with utmost caution.
Right. You know, we're talking about this specific substance. How does one who is buying a cough syrup know that the level in that bottle is under the permissible limits? And why is it that for the longest time, this matter has not been addressed? So who do you really hold accountable here?
I think the local state governments have to put up their socks. This is unacceptable. This is simple amounting to murder. You are subjecting small children to medicines which is adulterated with sheer poison. But with regards the buying of the medicines, pharmacists and chemists should never dispense medication, especially to children. They have no knowledge of medicine at all. A pharmacist or a technician or a chemist has no perception of what the symptoms are or what the disease is. It should always be with a valid medical prescription. The doctors need to be advised, they need to be counseled as to what doses are required. Pediatrics is a very, very separate ball game. It's not like general medicine or adult medicine or indeed what a family physician would practice. So it is best left to the specialist to treat, but use it with utmost caution.
We're leaving it there for the moment. Thanks very much for being here on the broadcast and sharing those inputs. Thank you.
Thank you.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.